Well, they say your hands give away your age, but there's another body part that might be showing your years just as clearly: your knees. They are the latest area that many shape-conscious women are really obsessing about, which is why Dr. Ann-Therese Stubbs of Ann-Therese Aesthetic Medicine has invested in the Thermi-Smooth treatment, and she's here to tell us about it. Good to see you, Dr. Ann.
Thanks for having me.
Are the knees like the new hands? Do you see a lot of women complaining about these?
It is amazing how many people complain about their knees. I've never known how many women hate their knees, but as time progresses, we lose some collagen in our skin everywhere, and we can get some of those kind of horizontal wrinkles across the knees or some sagging right above the kneecap. And when women wear shorter dresses or maybe shorts, warmer weather, that tends to be bothersome to them. Even if they work out, run, have a good exercise regimen, those little lines tend to bother them.
They can get a little self-conscious about those.
Yes.
So Thermi-Smooth, you have told us so many great areas this works on. So how does it work on the knees?
Thermi-Smooth is a radiofrequency technology that heats the skin. So it's not a laser, it's not anything that's going to burn. It just kind of warms up the skin and brings it up to a temperature of 43 to 45 degrees centigrade slowly. So patients tolerate this wonderfully. In fact, I've often said it's like a warm stone massage. So people often fall asleep during the procedure. But if we can use that energy to heat an area up for about 15 minutes, it tends to throw our fibroblasts into high mode to build collagen. So what that means is that the skin tightens.
So the treatment is very quick and painless, pretty much, right?
Exactly, and that's the beauty of it. It's non-invasive. It's just a topical treatment. Heating that layer of skin up to that magic temperature that we found really causes our own collagen to build. People love it because it's natural. It's stimulating your cells to make collagen, and it's a subtle difference too without surgery, so you don't look massively different, and people tend to like it because it's a slow improvement and they can see big results.
And let's look at some of those big results with the before and after, Dr. Ann, and tell us how many treatments these people had.
So these people each had 4 treatments. They're spaced about 1 to 2 weeks apart. We found too, with different size electrodes, we can start to work on cellulite as well. You can see in the first picture, she not only has some crinkling around her knees, just some irregularity in the texture of her, the front part of her thighs there, a little bit of dimpling, and Thermi-Smooth is being hailed as the new kind of savior for cellulite as well. So you can see
this
results.
Is like the end-all be-all. I feel like this does so much and without any pain.
And it does, and it's such a new technology. We've been using it about 2 years, and we're getting better and better results, just kind of spacing the treatments a little bit closer together.
Okay, so, and we look at this woman as well, and I mean, it just speaks for itself, the results.
And like I said, most of my patients don't want to become a supermodel. They're not looking for wildly different shape to their legs. They're just looking for some texture changes, some tightening, something that makes them feel better in a pair of shorts or in a bathing suit in the summer. Right,
to be a little more confident when they put those shorts on and go out.
Exactly, and you can see this young lady really she's thin, big workout, patient, and she really just wanted rid of some of those little crinkles above the kneecap.
Okay, so can they return to work right after? Are these treatments invasive at all?
And that's the beauty of it. You can put your clothes on and go right out. You could exercise that day. There's no compression garment that's needed. There's no drainage. There's no redness. There's no peeling. Just a little kind of pink look to the skin. And the wrinkles actually do look plumped out right after the treatment because the heat's all in there. And people do think they get an immediate result, but that usually that kind of swelling goes down in about the first day. And so over the next 4 to 6 weeks, you see a much better difference, and we're finding our best results are at 9 months. So you continue to improve for 6 to 9 months thereafter.
And once you see those results, are those permanent? Should you go back and get a maintenance treatment?
Usually we recommend people come in right about a year and get another treatment to kind of stimulate the collagen boost again, because as I've said before, I tell my patients, you don't go to the gym once and expect a result. You can't go get your roots done once and expect a result to last. Tragically, the aging clock does continue. So we'd like to keep that collagen building, and this is a great way without, for our patients who are fearful of needles and really want a nice, subtle, and comfortable result. Just kind of boost your own collagen.
And Dr. Ann, you always are able to offer our viewers a great deal to give something like this a try.
Yes, we always do a complimentary consultation and do a medical history, and then we offer your daytime viewers a 20% off the series of 4 treatments.
Okay, and Thermi-Smooth can be used on so many different areas, so even if this isn't the one you are interested in, come in, see Dr. Ann and her team, and I'm sure they can find you the right treatment.
Use it about anywhere.
All right, thanks for being here, Dr. Ann.
Thanks for having me.